We're all able to work all over the body whenever we need to be, and I've even heard some people call us kind of the firefighter of the OR. That when other surgeons get in the bleeding and can't stop it, they call us to come stop the bleeding. So that's actually one of those kind of heroic moments that you really enjoy as a vascular surgeon, when your colleagues can call you in. It could be a lot of different things before it is a vascular problem. For example, we can break it down. If you have leg problems, if you're cramping when you walk, some people say it's cramping, some people say it's fatigue, achiness. It can present a lot of different ways, and it can go from the hips, the thighs, the calves. And if you're finding yourself cramping where you have to sit down and it goes away and you're coming back in, I mean, that's something that could easily be a vascular problem or a blood vessel problem. And sometimes people think it's just arthritis, it's their legs, it's their back. It could also be that, but I think that's when it's starting to affect your life enough to where you can't get out. That's when you should start looking into that. And it's a pretty easy thing. We'd be happy to see you. Even if I was your first physician looking at that, I'd be happy to rule that out. We as a vascular community have done really well on. We have screening programs now, because if it ruptures, there's about an 80 to 90% chance of death from one of those. So if you can find it ahead of time and fix it, you can prevent that. So people who have smoked more than 100 cigarettes in their life, which is not much, like 3.5 packs or so, are a lot higher risk of having aneurysms than people who've never smoked. Or there are people with family histories of aneurysms, people with connective tissue disorders. They may have an aneurysm and not know it, just walking around, because it's kind of a silent thing. But there are programs that when you enter into Medicare, you can get an ultrasound on your belly, and it's quick. It's just like a female having a baby. You get a little ultrasound and you can rule in or rule out something like that. And that's huge, I think, and that's something you can work with your primary care physician to set up. So those are things that a lot of people don't know about, that actually are kind of there for you and are free for you to do when you enter in those programs. If you have a family history or a brother, sister, mom, dad with an aneurysm, you could probably qualify for getting an ultrasound just to make sure you don't have something like that. DVTs, you may hear like a deep vein clot, a pulmonary embolism, or a clot that goes to the lungs. You may know somebody who's had one. You may have had one yourself. There's a lot of stuff we can do these days if there are clots a little bit more centrally in the body, kind of in the pelvis or the belly area. Sometimes we can suck those clots out, or we can melt them away. Sometimes we just need to treat them with blood thinners, but that's stuff we take care of as well. And that's generally worked in with an emergency medicine physician or your primary care physician again. But you know, if they're concerned or have any questions, then we'd be happy to see you for those things as well.